Next, we're going to talk about what to do in the case of an exposure to a dirty instrument or a sharp. So if the instrument is clean or the needle is clean and it's just a scratch or a puncture, wound that can be just cleaned and put a bandage on, you can find the first aid kit with the crash cart. So just rinse it really good with a medical grade soap at the sink and then bandage it up. Now, if that cut was created, no matter how small, by an instrument that was dirty, then you actually need to go through a whole procedure that's covered under a workers' comp. So the form that's needed for this is in a red folder and usually stored near the crash cart, and it's called an exposure report. This is going to have the places to go for a blood draw. So a lot of times Concerta is a great location to use. They're very familiar with workers' comp cases and know the procedure for an instrument stick. So when you go, know that there will be a blood draw, and they will be drawing and testing for three things: A, B, C. AIDS is A, B, hepatitis B, C, hepatitis C. A, B, C. They're doing a blood draw to check for a baseline to see if you had any of these things at the point of contact or at the time of the incident. If you already had any of those conditions inside your bloodstream, then it was not induced or caused by the injury. And workers' compensation isn't going to cover the treatment of it. Now, if one of those, you have those three tests, you're test negative, and then they are able to identify the source patient, they'll ask that patient to go get tested for the same three things. If they're also negative, then we've just ruled out the chances of contracting those bloodborne pathogens. Now, if the source patient is unknown, or if the instrument came out of the ultrasonic shaker that has all the dirty instruments in it, then what will happen is the person who's exposed, which if it's you would get that first baseline test with the blood draw for the three conditions, and then you would wait a certain period of time based off of the risk level and what the exposure looked like, the incident, and they will determine when you need to come back and receive the same test later to see if you tested negative at the initial test, and then over time these conditions showed up after the exposure, then it's reasonable to assume that you contracted that condition based off of that exposure to the dirty instrument or sharp. And in which case the workers' compensation would help cover the cost of that treatment. So hopefully that is not necessary, but per OSHA, we need to make sure you are informed of worst case scenario, what steps to take, and what needs to be done if you are exposed to a bloodborne pathogen through a dirty instrument or sharp object while you're here. The person to talk to would be Mary Haniff, again, our operations officer in that case, and she would need this information to coordinate with our workers' comp. Okay, so hopefully you don't ever have to use that information, but we have done our due diligence and provided you the steps and expectation of what to do in case of an exposure.